I would really like to welcome Dr. Wahida Suresh to today's session. She comes with over 25 years of experience in reproductive health, obstetrics and gynecology, and in laparoscopic techniques. As an alumna of Madras Medical College, she's now the lead consultant in obstetrics and gynecology at BirthRight Rainbow Hospitals. And she was formerly in Apollo Hospitals too. So now she also strives to build a holistic women's wellness practice to address lifestyle management. And this was very interesting for us because she talks about nutrition, fitness, psychological fitness, and so on. Her other interests are also in training and mentoring frontline staff. So welcome, Dr. Wahida. What are the age-specific test health checkups that you think that need to be done, and how often?
Important question at the same time. See, basically, few tests are very age-specific. Few tests is based on the family history and the hereditary conditions, because it's very important. We cannot generally go always by age. Sometimes certain things are also based on any family history and also how they present. Sometimes, people can have some symptoms and signs very early which will make us do some tests, and it could be some hereditary. So, but basically, most important age specific, say, the tests, usually till 18 years, the pediatrician mostly take care. And, most of us, we are hoping that we are healthy when we are adult, till 18 years. And otherwise, usually between 20 and 30, most of girls have attained menarche, their cycles are regular, things are okay. So most of the time between the age of 20 and 30, what we recommend is a pap smear, which is very important. That is, now we have moved on, pap smear is a cervical screening, and no more, we don't believe in saying that, okay, you have to be married to do a pap smear. So today we all have to be open about discussing about sexual health and about safe sex. So we are also talking to young adults because they are aware that 2 years from any sexual exposure, they're supposed to be doing a pap smears.
Okay.
Yeah. So we are not, if somebody comes for pap smear, we do not ask them why you want to come for a pap smear or what is your. We are happy that they are coming for a pap smear. Because we all know cervical cancer is one of the commonest in the world. As you and me are talking, they say in 2 minutes, there are at least 8 women die of a pap smear, cervical cancers, which is more than any bomb blast or any catastrophes which happens. This is a silent catastrophe happening in our society where we need to be aware. So at any age, from the age of, from the 20 years, if somebody comes, meaning asking for, or you recommend a pap smear and maybe a basic ultrasound, pelvic organs, because now I'm sure you and me, all of us know every second girl says that she has a polycystic ovaries, or again, she believes she has polycystic ovaries, because again, the support system and the groups have become so, like how everybody has downloading apps, like that. Everyone now is so connected about health issues. See, in our generation, we never spoke anything about our health, even to our closest of friends. Something it was very personal to what today everybody discusses about it. So PCOS, yes, everybody might think that why is it PCOS is on the rise? I would rather say it's also because we're investigating early. Earlier, anything was okay, we wait and watch. Today, even anybody has 1 or 2 cycles which is irregular, the mother or the girl reads already about it in the Google, and they feel, I think, they come telling me, Madam, I have a PCOS. I'm suffering from PCOS, whereas it is not a suffering, it is not a disease, it's just a condition which can be. So, as you rightly asked, age specific, one between 20 and 30, a pap smear, ultrasound, and basic blood work. See, because again, any country, there can be nutritional deficiencies. And if you take India, equal amount of people are vegetarians. It's not everybody is a meat eater. So we are now I surely feel economically we have become much better than what we were. So I'm talking about the days when I did medicine to what we are doing now. Iron deficiency anemia was so very common then. Every woman was anemic. Today we have really grown, better in economically, financially, and everybody understand the concept of healthy eating. Even then, a common, checking of the hemoglobin. And yes, vitamin D, we have realized it's one, the Indians, I think, are ethnically very low in vitamin D. So,
Yeah.
but though being a tropical country most of the time, we don't like sun.
Yeah.
And lifestyle has changed all the more with the last 2 years of pandemic, where nobody has had exposure to sunlight. And again, nobody anymore goes out to outdoor activities. And it is not in our system to do outdoor activities. As again, a community, we are not that outdoor people where you go trekking or cycling. Maybe it's changing, but mostly it is like we are all indoors. So basically, between the age 20 and 30, if somebody is asking for a health checkup, we would tell them to just have a basic blood work of their iron supplement, so get their hemoglobin done, and probably a vitamin B12 and D3, and a basic ultrasound, and a pelvic ultrasound. And yeah, that's it. Even in that group, as I said, there are families which may have some blood sugars. They can say my parents are very early diabetics, or their parents can have sometimes thyroid issues. In such girls, and you see, look at them, their body, if they are very lean or obese, where they say their cycles are irregular or more, then we may also add their sugar, checking whether they are pre-diabetic, or how was their glycosylated A1C, or do they have any hypothyroid issues. This is what will be between the age 20 and 30. So, and they'll be also in an age when they're going to get married, so they may have, then that becomes very specific requirement for anybody. So basic, this will be the overall, as a group, your blood levels for iron and your vitamin deficiencies, and if required, your iron and other requirements. But in case somebody is today talks, I'm sure today at least in my consultation, at least 2 young girls come to me asking for oocyte storing their eggs, because they would like to know the fertility potential. So yeah, if somebody, this is not very individualistic. When the requirement is there, then we also do their anti-Mullerian hormone, which indirectly tells you what is your biological potential of your ovaries. And if you do not routinely do hormones for everyone, not really necessary, but if there are very irregular cycles or abnormal cycles, then maybe we will add their follicular and luteinizing hormones. And then from the age of 30 and 40, then as I said, and surely from every adult, every young adult, we have to start talking to them about breast examination. We do not have to wait breast examination at the age of 40. Though the breast cancers, everything comes later most of the time, but it does not mean we do not see young adults with breast cancers. So the first visit by any young adult, that is an opportunity to talk to them about their sexual health, about their breast health, and to say what they should expect. When do they do a test? So talking to them about self-examination. Usually we recommend them to do a week after their periods, because during their periods, the breast is very tender and painful, so we'll not be able to examine. So routinely, as a part of their routine, we have to teach them about, self-examination of the breast. And again, anything abnormal in their system, they notice, should be recommended. So this becomes part of also talking and screening. And again, between age 20 to 40 is a group where, for many people from 30 to 40, life is changing. Few people would have completed their family. Few people will be, will be in the reproductive age group, and they also have some lifestyle disease, conditions. They would have gained weight, or because of their work, change of space. In such situation, yes, we need to talk to them about their cholesterol, about their, whether they, about their food habits. And here comes the role of getting their lipid profile done along with their sugars and the hemoglobin, and a basic screening of the ultrasound breast. We do not lose anything, because again, fibroadenomas are so very common. In like how uterus fibroids are common, fibroadenomas are common for many women. Surely they do not increase the risk of any breast cancers, but when they do a self-examination and you come and tell that I feel some lumps and bumps, a reassurance by a breast ultrasound does not, we don't lose anything. And again, a personal history of asking them if there is any family history. For example, many people, if they have a family history of breast cancer or ovarian cancer, then comes the individual specific investigation. For example, if any parent or the first degree relatives have had a breast cancer, say at the age of 40, then we start screening from the age of 35, at least 5 years before. Or if they had a mother or our grandmom, more than 2 first-degree relatives having ovarian cancers, then there is a marker called CA-125, which we recommend them to take every year once, along with the routine test. Okay. So yeah, and above the age of 40 is, mammography, we recommend a mammography from the age of 40 onwards. And depending upon the family history, mostly between the age of 40 and 50, we recommend a mammography once in 2 years and a pap smear and basic lipid profile. And if there is a risk of cardiac illness, yes, some additional tests for this. And again, of all the vitamins and all the rest. And individually, again, if there is a family history of any cancers, then we talk to them about doing their CA-125. And if there are family history of colonic cancers, though it's little more common in men than women, but does not mean, so if there is a family history where there is breast, ovarian, uterine cancers, or colonic cancers, we also add carcinoembryonic antigen as a marker to check their gut health or any risk factors. And pap smears regularly. We recommend, each country differs in a different pattern. Some countries say 3 to 5 years, and because most of this in UK, US and all, it is all driven by NHS or sometimes. But here it is still, you can decide. So I recommend people to do at least once in 2 years, or we do not lose anything by doing once a year. What I've noticed in the last few years of my practice is, you tell them come once in 2 years, they always forget the second year and third year. Rather, I tell them, remember your birthday or your wedding day or something, or some day which will be very special, and mark yourself as a special day to screen for your health. Because doing once a year pap smear is also, it's not, because you're not doing, it's not an invasive procedure.
Yeah.
Because typically, if you see, we tell, okay, I'll see you in 2 years, they never come in the second year. Yeah. And they're also thinking, I thought I came last year, and then it will be almost the 4th year. And some may we would have missed. Yeah. And, none of us, it is very different. We are ready for a holiday, ready for shopping, but not ready for health screening. We always, say probably the next one. So once a year, basic screening, like an ultrasound of your breast and the uterus, the basic blood works. Pap smear is fine. Additionally, if there are special requirements, we can do.
Yeah, that's good to know. And so as they grow older, like post-menopause, is there something different, or is it the same thing?
Yeah, post-menopausal, yes. Yeah, see, we all know that as women grow old, their bone thinning happens, because it is directly related to the estrogen. So bone density is recommended after the age of 50.
Okay.
Yeah.
After the age of it.
So again, we can add some serum calcium and vitamin D, all these can be added to the screening test.
Yeah. Okay. That's good. About vaginal dryness, urinary incontinence. How does this play a role in midlife health and urinary tract infections?
Yeah. So for women, if you see, we are totally driven by the hormone estrogen. Is a well-being hormone, and the estrogen hormone receptors is present in the urinary system and the bladder for all women, because so as we age, the estrogen level comes down. So it directly affects the bladder and the urinary tract. That's why typically, I'm sure we all have experiences. We are held on to our bladder in school. We never used the washroom. We used it at home and went back. But as we age, maybe even in college, it's okay. But later on, when you feel I want to pee, it has to be that immediately or somewhere. Or you also develop a stress incontinence where your laugh or sneeze, you feel there is a bit of a dribbling of urine, or there is something called an urge incontinence, where the minute you feel you want to. And also for women, unfortunately, post childbirth, also, the control of the bladder and where they say the control has come down is also a very common one, because sometimes when there is prolonged labor, where the baby's head is sitting on the bladder for a long time, or a difficult labor, there is a bit of a descent of your bladder down. And also, so these are the conditions. And as we age, middle age, as you typically, estrogen receptors, when they come down, the bladder and the urinary system becomes very sensitive. And because there is a less estrogen, the milieu in the vagina, the pH changes. See, vaginal pH is very much an acidic pH. So if you notice, the vagina is actually exposed to the external world. For the women, the urethral hole, the vaginal hole, and the rectal hole are all in the same line. So it has literally two enemies in between. Urine also carries microorganism. The rectal also carries microorganism. What is a friend in your gut? E. coli becomes your enemy in your urinary tract. So if you see, the commonest infection is E. coli, which is actually a gut flora. So we are always have to be under vigil. And most of the time, as you're aging, the estrogen comes down, your bladder becomes more sensitive to infection. It's also because your pH changes. So how do we see? A few things we cannot change. What we can do is like lifestyle management, increasing your fluid intake, wearing loose-fitting clothes, airing yourself. And when you're long sitting, long travel, when you go, you should be prepared to get down and walk for some time, literally airing. And sometimes probiotics help. And these are the lifestyle management when we talk to people, like, this is expected. So there is a word called bladder drilling, training your bladder to hold on. So where pelvic floor exercise plays a very big role. We talk to them at how you can improve your pelvic floor muscles, which helps you to, as you contract and release, there is a little bit of regeneration of your blood vessels, more blood flow. And so that way it helps. And also not to hold on to your bladder for a long time and empty your bladder. And at anything little, at the earliest, if you feel there is some change, treat the condition. Like, people may have some burning sensation of urine or some early urinary culture sensitivity test, so we can pick up what organism is going. Or if there is any change in your vaginal discharge, which you think is abnormal, visit your doctor to treat. It could be an yeast infection or it could be vulvovaginitis. Because unfortunately, all these, you become more prone as you age, mainly because of estrogen deficiency, pH changes. So lifestyle management, pelvic floor exercise, bladder drilling, and addressing the condition at the earliest so that you can prevent all these. And if nothing works, sometimes we also recommend estrogen creams for some time, which helps to rejuvenate, and sometimes lubricants also.
Okay. And this is especially for vaginal dryness, or this?
See, vaginal dryness, even vaginal dryness is because of estrogen. So what happens when there is vaginal dryness? Naturally, there is a change in pH, which also can, allow the other, what we call as commensals, the pathogens we are already in your system becomes, they cause what is known as opportunistic infections. They wait for an opportunity to attack you because your immunity there has changed.
Okay. Yeah, I get it. No, that's good to know. What contraceptive methods can be used? And somebody has specifically asked also, apart from barrier method and the pill, what can be used and what are the misconceptions about these?
Contraception is still, I feel totally people, they always miss out on contraception, because I think contraception again should be sexual, which should be spoken to everyone. And there are different methods of contraception. Take contraceptive pills, and is one of the time-tested long-term, where we have enough evidence-based, which most of the time contraceptive pills are not unsafe. Because many a times when you talk to them about, okay, when somebody comes and asks, see, I don't want pregnancy, I want to be very safe. Then, a young adult who does not have any other risk factors. When I talk about risk factors, if there is a family history of early heart attacks, if somebody has a family history of blood clotting disorders, if somebody is morbidly obese, or they have a history of a very sedentary lifestyle, then we do not actually recommend contraceptive pills. But if somebody is a young adult, up above, meaning healthy adult, who does not have all these family history, and they are very active, and they are very sure about their requirement because they don't want to have a pregnancy, then contraceptive pills are quite effective. So contraceptive pills, so that is what I'm saying. There's a lot of advantage because it helps in cycle regulation. The pregnancy rate is almost nil if you follow it properly.
Yeah.
And time tested. So
Yeah.
we should not have a total misconception about contraceptive pills, because the first thing people say is, okay, it's a hormone which I don't want, and I have possibility of gaining weight, so I don't want to. If anybody follows a good lifestyle and they are very conscious about what they eat and fitness, probably they may gain 1 or 2 kilos or may not also, if you keep yourself fit.
Okay.
And unless, somebody has severe mood swings, very rarely, contraceptive pills can affect your mood. So somebody, any young adult, anybody is on antidepressant medication or any drug which affects the liver, like anti-epileptics, such people, maybe we do not recommend contraceptive pills. Otherwise, for a young people less than age of 40, between age 20 and 40, they want a good control of their cycles and they don't want unwanted pregnancy, then contraceptive pills is not bad at all. Okay. Then comes the intrauterine contraceptive device, which commonly known as copper T. And we also have some hormone impregnated devices like Mirena. So these are recommended usually for women who has had children and who want to space children between the first and second, where only copper T, which is non-hormonal, is recommended. But the small disadvantage is sometimes it can cause prolonged bleeding, little like low back pain, spotting. Very rarely it can prolong excessive discharge. So these are sometimes a disadvantage. So it is very difficult to say everything will suit everyone. It is very individualistic. So when we talk to people, like we tell them, depending on the requirements, for example, a young adult who wants contraception, who's very sure they don't want anything, a pregnancy, then and if they don't have any contraindication, pills are good. If a married woman comes who has had a children, wants to space, and a requirement is only contraception, her cycles are regular, they don't have any health issues, probably a non-hormonal intrauterine device is good. But there is the same woman comes and says, my cycles are very prolonged, there's a lot of bleeding, I want my cycles also to be shortened, then intrauterine contraceptive device with hormone like Mirena helps, because advantage of Mirena is it regularizes your cycle, reduces the bleeding, and also gives you. There are some people who say, I don't want anything inside me, I don't want a pill because it's hormonal, I don't want a contraceptive device because I think there is something inside, then yes, barrier contraceptive method. But we should again have to tell them, if it's a married woman who doesn't want a child, barrier method is not totally foolproof. There is always a risk of failure in that. And also many people have the misconception that I use barrier only during my fertility period. That where what they follow the calendar method. The calendar method is the most unsafe. See, basically this calendar method is recommended for people who do not want to follow any method. And sometimes people have some religious beliefs and all. Otherwise, the calendar method has most of the time unsafe, because how do you, any time ovulation can happen after the 18th day, or ovulation could have happened before the 12th day. So barrier method is for somebody who you have to use always, every time.
Yeah.
That means you always use your barrier method. Yeah, and true. Then there are injectable contraceptives. And sometimes injectables, once in 3 months, you can use injectable contraceptives. But again, the disadvantage of injectable is your cycles can become irregular, they can be spotting and a bit of bloated feeling. So injectable contraceptive pills is usually recommended postnatal, when a mother is feeding a baby and she just does not want to take a pill every day. She wants a contraceptive which is safe in breastfeeding. Then we recommend either injectable, or there is something called mini pill, which is progesterone only pill. Okay. The progesterone only pill can also be recommended of people who have a risk of with estrogen, then that can be also recommended. Again, the disadvantage with this mini pills are the cycles can become irregular, prolonged, or you can have a prolonged spot.
Okay. Yeah, no, that's good to know. And this should continue till menopause,
Yeah, see, after 40, so yeah, again, as I said, contraception is also very age specific.
Yeah.
See, till the age of 40, we are comfortable with pills, and somebody comes up to the age of 40 and says, see, I'm done with my family. This is the time I want to have a break. I still, because yes, there is a risk of a woman becoming pregnant till menopause. So someone says, like, I just want to have a, finally a life where I'm not thinking about pregnancy. Then contraceptive device is one of the safest, because once you insert, it suits you, it is valid for 5 years.
Okay.
Or if they don't want to, then probably, barrier method condoms is good for them.
Okay. And regarding this, was one question in the group. Can birth control pills or dehydration from extreme heat cause vaginal dryness?
Contraceptive pills, yes, they can have a bit of a vaginal dryness, because see, it is a combination of estrogen and progesterone pill. Basically, indirectly, what does contraceptive pill do? They suppress ovulation.
Yeah.
So somewhere there is so some people do talk that when they start, with their pills, sometimes they have the vaginal dryness. So yeah, we recommend them to use lubricants, but not always. As I said, it's very subjective. Not everyone is on a contraceptive pill talking about vaginal dryness, but if you see theoretically, yes, there is a possibility because of the hormonal, it's a hormonal contraceptive pill. And dehydration, see, if we feel dry when we are very dehydrated, so including your, there could be some vaginal dryness.
Okay. Yeah. Then let us go to how to tackle pre-menopause and menopause, because I think there's another question regarding what to expect in sexual activity when we hit menopause. So in general, I think the question is what happens pre-menopause and menopause.
I feel sexual is very much in your mind. Frankly, your system is like, as you age, your priorities change. The couple's priorities change. I wouldn't say because of menopause, because I meet in my practice women at 30 saying that they have no interest in sex, and I equally meet couple at 70 years who are so active in sexual life. So I think it's very couple driven, what everybody expects, or what, having sex every day is not abnormal, and not having sex, having sex once in a month, twice is also not abnormal. It is how you're satisfied, how you're wanting, but yes, sometimes a bit of disinterest happens because again of your hormonal imbalance, as the estrogen is coming down. So sometimes because there's amount of vaginal dryness, and sexual intercourse could be painful. So what happens whenever it is painful, you want to avoid that. So then, you're finding reason to say, actually, I don't want to have, because for some people it can be more, menopause or perimenopause can be very dramatic, we say, where they typically come with the symptoms of extreme dryness, palpitations, and sweating, and they are not sleeping enough. And then so naturally their focus changes. They're more worried about, why am I feeling so low, and a lot of mood swings and depression. A lot of factors. Again, I feel we should not always, it's typically people say, I think I'm menopausing. What it is also because, see, we all so much involved in our children, and who come to us every day, and suddenly when your child is growing, they don't want you. Somebody, I think every woman goes through that feeling of, nobody needs me, I think. It's like, or everybody feels, okay, I put in so much of my years of, which could have been productive in child upbringing, and your child says, I know better, please, I can take care of myself. So there is something of this emptiness syndrome added to your hormonal imbalance. And then, and even your spouse could become more involved in their jobs, in their work, where they may not be giving enough time for this. See, even men have andropause, where their requirement for sex also sometimes change. There are equal number of men do not even want to after an age. They feel happy talking to you, reading a book, and then so I wouldn't say it's only because of the hormones. There's a lot of other things play a role during your, but having said that, menopause does not stop anyone from having sexual intercourse. You can be as active as you can, even at the age of 70 or 80, or you can stop. It depends on multiple factors.
So apart from this whole sexual health, during this 40s and 50s, the perimenopause time, what are the changes women go through, and what is it that they should expect? Should they do anything extra in terms of checking their health?
So fitness, I think, is the most important, right? Diet and fitness. See, that I feel it is from womb to tomb. Every human being has to be conscious about how they can keep themselves fit, and so there's nothing like I'm going to be fit only to during this period of time, or I wait till 50 when diabetes and hypertension hits, and so I'm going to start. I just feel like why it was so important in all schools to have a physical fitness. We had it as a subject, or what was the reason to inculcate that habit that you need to do something, anything, right from the time you're born to death. We need to do fitness. So for women, especially perimenopause and menopause, so it is a time, again, your hormones are changing, you're gaining some amount of weight, and the estrogen is coming down, your bones are starting to thin out, and there is some amount of fluid retention because of your progesterone. The cycles are becoming irregular. So, and along with this, your moods are changing. So it makes you feel so down because you're not able to do what you want to do. So it is so very important to put your life in order by doing some fitness every day. Default. We all know universally when you do exercise, your happy hormones, endorphins are released. That makes you happy. That is one reason. The other reason, what is very important, is strength training. See, muscles support your bones. And for the bones to be supported, you need a good muscles. And especially for women, all the more important is to do resistance training, strength training, weight training. People have a misconception that I will develop biceps, triceps. I need to, I don't want to look manly. Actually, not so at all. It is so very important to build your muscles. So, and it should not be overnight, And I don't say that everybody has to go to a gym, I do not. But I tell people, default, get up and just get out of your home. It can be for a walk, it can be a jog. You can do some resistance. Today we have so many varieties of resistant bands or dumbbells. Something, surely resistance exercise, like some floor exercise, like running, jogging, and as a combination. You don't have to do the same. See, for example, some people say, I've been walking every day and nothing happens. See, walking is a good cardio. It is good to have a walk, but you need to have variety. For example, remember, so okay, in an Indian setup, if I'm going to eat sambar every day, don't you get bored? Why do we have a variety of meal every day? Your body also requires a variety of some, it has to be challenged by different, if I'm going to have only mathematics every day, or if I'm going to read only biology every day, it's boring. Why do we have, so everything is a mix. Even in a school, we were taught different subjects.
True.
In the same way, your body requires different types of exercise, which is challenging to your system, which helps you to improve your muscle, which indirectly supports your bones, which surely, as we age, the biggest fear we have is about osteoporosis and fall, and restricting your physical. So started, you don't wait for you to develop osteoporosis to do exercise. Rather, do exercise and do strength training to prevent osteoporosis. So some amount of sun exposure, eating healthy, making sure that your dietary calcium is good. Not necessarily it's only have to be milk products. Today there are enough dietary supplements you can, and strength training, running, jogging, do something, but we have to do something. That way, it's so much of positive health, See, everybody, what do we all aspire, or what do we aim? A good, healthy life, right? It's, if, unless we have a good, healthy life, our mood is not good. We're not able to perceive one, we cannot travel. So there are so many restrictions. So for that, especially, I recommend perimenopause, menopausal women to give importance to their fitness. And diet. We all know diet is 80%. We don't have to be very, eat something which we do not like for 1 week. Again, we can give some, there could be some cheat days. Some days we can have, say, in a week, 3 or 4 days, we can be very conscious about what we eat. In a day, weekly once, maybe, I love pizza. So when my patients come and I always say, probably weekly once, okay, 1 or 2 pieces. I'm saying be moderate, because see, again, food is so important for human being, If there was no food, I think nobody would have worked harder, because eventually the basic requirement for any human being is hunger and food, for which we work for better life. So being moderate, but very conscious about what you eat and very conscious about what you do can really give you a positive, energy to go through your menopause and perimenopause.
That's very good to know. Yeah, and it's something that we need to start thinking about, because I think for us, we don't realize when we are hitting that stage.
Yeah,
And then
because
we
if
are just
somebody says
said,
I don't have time, we have to create time.
yeah,
Time is, we can manage time. It is only because we don't know to manage. It's very normal. We always say, okay, I can start from tomorrow. Okay, today I feel like sleep. But tomorrow never happens. But at the
yeah,
same time, every day is a second chance.
yeah.
So think that every day is a second chance and start doing something.
Yes. Thanks for that inspirational part of that answer. Now, if the symptoms are too severe of the menopause symptoms, what is are there medical options, and how is it medically
Okay.
treated?
It's very individualistic, right? We say, maybe you're asking, but like, hormone replacement therapy is not for everyone.
Okay.
Like HRT, because basically people say, so HRT is not, again, it is very individual, depending on the requirement. For example, if somebody says, say, I'm not able to sleep, or I have palpitations, or, sweating a lot. First thing, again, we talk to them about is positive health. Like we say, okay, drink plenty of fluids, wear loose fitting clothes, do some meditation, get up in the morning. See, all these people, when you take a history, they would be sleeping because they're taking an afternoon nap, or they may not be eating properly. They may be eating late and going to bed. So naturally, as I said, as we age, because of the hormones, your even digestion is delayed a bit. Typically you feel a lot of bloated feelings. So we tell them is change your lifestyle. A counseling to understand what is their lifestyle, bring some change. If that doesn't help, then yes, address specifically. If there is palpitations, we may treat the palpitation, which is really bothering. And as I said, if it is mainly the urethral syndromes, urethral symptoms, like, frequency of urination, or there's severe dryness, and then probably we give them estrogen cream. And beyond that, then it can be, or there can be estrogen receptor modulators are available, not specifically estrogen tablets, but we have estrogen receptor modulators. If I will give you a trial and check with them whether that, if they say it alleviated the symptoms and they're feeling better, yes. And in few women who have had premature ovarian failure, for example, there are some women who stop menstruating before the age of 40. We call them as premature, or whereas in such women, there it has a help in starting them on HRT, because surely, but HRT should not be given to prevent, like, because estrogen is heart protective, bone protective. So I'm putting you on estrogen as a general. Whereas lifestyle management, if you can keep your cholesterol under control, if you can do exercise and health, you can keep your bones and heart under control. So HRT should not be like the general, okay, how you attain menopause, here there is a prescription for HRT. No.
Okay. No, it's okay. So so HRT, you're saying it's an individual based therapy.
Yeah, at least
and
in
also
our country, we do not start.
Yeah.
At least in India, we do not start HRT just like that. It is depend based on each individual. Yeah.
Yeah. But for premature ovarian failure, at that point, they do start it, but also give them lifestyle.
We lifestyle, along with lifestyle, we may start them on HRT. Yes.
Okay.
Or too early, then they have surgical, hysterectomy for some reasons when they were very early, some very rarely for a emergency. Sometimes we do a hysterectomy when they are in 20s during childbirth. Many women, when they're going through a postpartum hemorrhage, or for some reason when the uterus is removed. So even if the ovaries are left behind, that when the target organ is not there, sometimes ovaries do not function. And if we feel their bones are thinning, there is a possibility in such people also, for a few years, 4-5 years, HRT can be given.
Okay, that's good to know.
So it's totally based, very individual, but not as a general, like it's not the over-the-counter prescription for sure.
Okay. That's good to know. And you said even if if the ovaries are there, though the hormones are there.
Yes, if somebody has had a hysterectomy very early, and even if the ovaries are left behind. See, for example, if we do hysterectomy for women between the age of 45 to 50 for some uterine reasons, And usually less than 50 years, we usually do not remove the ovaries if they are healthy. In such women, we do not start them on HRT at all. But if somebody has hysterectomies in 20s and 30s, though the ovaries have been left behind, see, it is like when the target organ is not there, the ovaries are not going to surely function to their fullest potential.
Okay, yeah. The feedback is not there.
Yeah, exactly.
Okay. Yeah, so I think that is the main questions. There was one point that you had brought up when I spoke to you earlier about PCOS and how it can affect you later in life, in midlife. So that was interesting.
Exactly. See, polycystic ovaries, I feel we are born with, if somebody is born with PCOS, if they're going to be with PCOS, it is like before PCOS conquers us, we conquer PCOS by good lifestyle management and keeping ourselves fit.
Yeah.
Because we all know, at least roughly, that it is because of insulin resistance, where there is impaired glucose metabolism. So your body insulin is not working effective enough to break down your sugar. So indirectly, there's a lot of ways why your estrogen becomes imbalanced. So that does not stop when you reach menopause.
Okay.
Like people say, okay, I'm done and dusted. So what I meant is, so this insulin resistant impaired glucose tolerance, because we all know women who have chronic PCOS also run the risk of having endometrial hyperplasia. That endometrial thickness, they have an increased risk of endometrial cancers. They have a risk of developing diabetes, which can also be a reason for developing hypertension. So it should not be like, okay, I had PCOS. My aim was to have children. I was fit at 30. Now I become a grandmom. Who cares? I can wear XXL size clothes, or I don't mind looking like a grandmom. Yeah. So I don't worry. All the more reason you need to be more conscious about your lifestyle. So it is something, see, that is why I meant womb to tomb health fitness have to be hand in glove, that, as much as possible, till such time you're really not able to do things medically or you are unwell. Otherwise, I think fitness and the concept of keeping a good lifestyle should continue post-menopausally also, all the more because you have all these risk factors.
Yeah, that's good to know, because I think that's something I've not heard before, and it was good to think about it differently. The PCOS can affect you later on. I think that is all the questions that we had. And so far we have answered also the questions from the audience. Are there any more questions from the audience?
Yeah, there was one more question, but I think she had kind of answered this: how to take care of bone health during perimenopause. And then I would love you to end with any parting words for all of us.
I think, as I told you, womb to tomb fitness. And I feel it all the more reason it makes you feel very happy. For me, like as I said, like I'm just after this session, I'll go and do a 5-kilometer walk because I missed my walk in the morning.
Wow, okay.
Yeah, for me, it's just, there is somebody I've seen in YouTube, there is somebody Grow with Joe. She's so good in, like you can burn 600 calories in 1 hour following her exercise. So I make sure if I miss something in the morning, I do something in the evening, and you sweat it out. And when your Apple Watch says, okay, you've burned 600 calories, you're ready for a good dinner. So you feel you earned your dinner. As I said, every Sunday I like to have 1 or 2 pieces of pizza. So I'm going to do my 5 kilometers walk and probably ready for my pizza. And I just feel I feel we are blessed to be women. Frankly, I don't feel bad, because they always, sometimes people say, oh, why I was born to be a woman. Rather, I'm always proud to be a woman, because I think we bring the change in this world. So if a mom is fit, the children are going to be fit, and the entire generation, because for example, see, I because I'm so much into fitness, I make sure my daughters, I have twin daughters at 27. So they are doing something in fitness, I'm sure. And then I always tell them, when your children look at me, a fit grandmom who's playing shuttle or running or walking, probably they'll end up doing some exercise when they see me. So we should be the bearer for good qualities, what we can inculcate in the future generation.